Representative Olson.
Thank you, Madam Chair and members. I think it's fitting that we're here today on a very cold day. This discussion is not new today. There are a lot of folks who have come before us, including Representative Baker and many in this room who have worked for a long time. For my colleagues that are asking for more time, I would just remind folks that even the amendments you are offering are part of a bill that was in your control last year, and we are here again today. So there is urgency. One of the testifiers that cannot be here today is Lieutenant Jeff Kazel from the Duluth Police Department. And the reason he can't be here is because he is fighting this crisis back home. There is urgency that we all know from personal standpoints, from community standpoints. In my community in December, we saw the highest number of overdoses that we have ever seen due to the opioid crisis. Our folks know that every day that we don't act is a day that a life could be lost. And we ask everybody to come to the table, and I think this bill brings that forward. And so I think it's really fitting that we're here today and we're not waiting any longer to address a crisis that many of us in the room have felt on deeply personal levels. And from a state legislator perspective, we're asked to act. The public is asking for us to act because this is a crisis that we're facing from our state budget perspective. It's costing our counties. It is costing every taxpayer in this room. With every day of inaction we have, this costs us more and more in personal and financial losses. And so today is a new day, and we're bringing forward a great piece of legislation that is at stop number 1. This will take several stops along the way. I have no belief that this is the perfect piece of legislation out of the gate, but I'm committed to working with folks here around the table, from folks on both sides of the aisle, to make sure that we continue to work together to do a bipartisan effort to incorporate as many voices as we can into this bill. So with that, I will get into the bill, and I will also be turning over to Representative Baker in a minute to share some comments as well. So to the bill in front of us as amended, what we've put forward is a bill that is going to be looking to generate revenue from registration of a registration fee for manufacturers and distributors. So you'll see that in the first part of the bill. We're going to be asking an advisory council to form with the various stakeholders to then look over the funds that will go into a special account to be able to figure out how we administer these. Through this bill, we'll also be looking at how we go upstream and continue to keep this crisis from happening through prevention and education efforts. We are going to be having grant funding for our various departments and commissioners to work in close contact with the advisory council, so that we're talking about existing prevention methods that we know work. We're talking about looking at innovative new methods of what we'll do to address this crisis. And a particular part I'm excited about that you see reflected in the amendment that we just put forward today. For those of you that were at last Friday, we had the opportunity to go to Mille Lacs, and we had the opportunity to hear from tribal governments, which are some of the tribal leaders and tribal representatives who, and we know tribal communities are some of the hardest hit by this crisis. And so we've added in language to reflect what we heard on Friday, to be able to offer these funds to culturally sensitive and culturally appropriate programming in those areas as well, which I'm incredibly proud. And I think this bill really gets to the spirit of holding accountable that which needs to be held accountable, and providing culturally appropriate, innovative, and proven ways to fight this crisis through education, prevention, and treatment. And so with that, I'll turn it over to Representative Baker.
Representative Baker.
Madam Chair and committee, thank you for allowing us to have the bill here today. I just want to make a very quick statement because we want to get to the testifiers as well. I have worked on this bill, or like this bill, for a long time. I also want to thank a lot of the members that are sitting at this table and folks that are not here at the table that have helped us write this bill. Representative Albright worked a lot of stuff on this bill with federally qualified health care centers that can do a lot of great work. Representative Kresha did some great work in Morrison County with that is currently spawning more medical centers that are providing naloxone and also Suboxone support for people that are in full-blown addiction, and it's amazing results. The ECHO project is going really well from the folks in Morrison County. Representative Kunish-Padin helped me write the Jake's Law education system in this bill, and components of that are straight in this bill. There are a lot of really good things in this bill, and a lot of members have responsibility and should take great pride in where this bill is at. As Representative Olson has said, we do not have this bill right yet, and we have a lot of places to make it better. I am committed to doing that, and I allow our testifiers to tell us their story. With a 55 low wind chill, I can't imagine a better day to do this right now to warm the hearts of what we have to hear. So with that, Madam Chair, I'll turn it back to you.
And Madam Chair,
Representative Olson.
I also, to the point I made about the visit to the Mille Lacs, they weren't able to be here, but did want to send a letter of support for the bill in the language we're including today.
That is great.